Good afternoon and welcome to the lovely podcast, The Endurance of Labor Laws. I am your lovely host, Lesley Sullivan. If you would like to call in, you can reach me at 405-314-1119. You can also message me directly from my podcast website. There is a message button there that you can press, and you can message me questions, comments, feedback, whatever the case may be, and I will respond to you as soon as possible. So for this podcast, I wanted to go over Obamacare because that came up in some of the unions I have looked up when I was doing research on some labor unions. And it really disappointed me that we have unions that supported, whether openly or not openly, most of the time they were openly supporting Obamacare when that was being pushed through our legislation and for it to be passed. I was very disappointed in that because the Affordable Care Act was a form of government takeover of our insurance companies within the United States. So for those that are listening outside of the United States has privatized medicine, which means it's not socialized. It's not predominantly provided by the government. And the reason for that is because we believe in capitalism, we believe in a free market, and we believe in purchasing what we want when we want. It has been my experience, and I've mentioned this before, where I got really ill. I'm a lot better now. Actually, I'm completely well now, but I was interested in immigrating to the UK for the sole purpose of getting better access to medicine, and then when I researched it, I saw that their access was way worse than the United States. So it was better for me to stay here and to get really good health care here because under socialized medicine, they try and make it a one-size-fits-all for healthcare, and that's not how healthcare is. Healthcare is supposed to be based on the individual, not the society as a whole. And unfortunately, with socialized medicine, you're not really seen as a person. You're just seen as a number. And so you don't really get the best quality healthcare, and also there are a lot of waiting lists. And, Sarah Palin was right when she's talking about how you will have death panels. And that is very true because that's what happens when you have the government in charge of your health care is they decide if you get medicine, if and when you get medicine. And I know this for a fact because I've met several people over the years that are from other countries and they sacrificed everything to come to the United States to get proper medical care because they could not get immediate access, much less proper health care in their own country, so they had to sell everything, or they may have had a lot of money and they came over here and just purchased it. So that's very disappointing there. And so with the Affordable Care Act, also known as Obamacare, what the federal government tried to do was to try to take over the entire health insurance industry. And the federal government has no business doing that because it can't even provide really good or even decent health care to our senior citizens, our veterans, or those that are poor. And examples of this are Medicare, Medicaid, WIC, which WIC is Women, Infant, Children, and then whatever policies are used to provide health care for our veterans and also our military personnel. And I just look at it this way, if our federal government can't even handle those social programs, how can it handle all of the citizens of the United States? If those people that I just mentioned before are not getting quality health care, then why would I expect the government to care about me? That's a very reasonable thought to have. And it's also very concerning that these unions, some of them supported the Affordable Care Act and they really want it to pass. And I don't understand why they would do that because the Affordable Care Act limited health care. It did not make it more widely available. So I would think that, if I was in a union, I would think that my union would not push towards having limited health care and have it being completely run by the federal government. Because the federal government can't even run the DMV, and the DMV is the Department of Motor Vehicles. And if you have socialized medicine, it would be like the insurance companies no longer exist under socialized medicine, and getting health care would be like having to deal with the Social Security office or the DMV, which no one can actually stand having to deal with them because it's so difficult. It's a pretty large bureaucracy. And it's very difficult to get them to do the right thing and to do things in a quickly manner and in a proper manner. And it's very discouraging when you're having to deal with those agencies. So it was just kind of eye-opening. I didn't realize unions were so involved in politics. I didn't realize they were so involved in the legislative side of things, and they shouldn't be involved in that because they're not part of the legislative branch of the government. They're not part of that at all. A union's responsibility is to help their members get really good pay at their jobs and have good health benefits within their organization, not try and push their benefits, through the federal government. Because the federal government is not known for wanting to pay for people's medical care. And a perfect example of that is Medicare and Medicaid. Like, the only thing that the federal government willingly and wants to pay for in terms of health care is birth control, abortions, and really cheap antibiotics. But that doesn't cover hardly any of the problems or the healthcare issues that we have. Here's a thing, like, not everybody is sexually active. And of the people that are sexually active, not every woman is on birth control. Not every woman needs to be on birth control because you have some women that either can't have children or they are beyond childbearing years. So, the fact that the government is quick to dole out birth control and abortions, that's kind of concerning in itself, but it's neglecting all the other types of healthcare services that you need in a society. It's just kind of one of those things where it's like the federal government, when it comes to healthcare, the only thing they really want to cover is stuff for the healthy or the young. And it's like, well, that may be a good start, but that doesn't begin to cover what the society needs, what any society needs. When you have a society, and if you have a government that's wanting to provide health care, they need to provide for all, if that's what they're going to do. And here's another thing. If you have government insurance or, socialized medicine, the type of medicine that you should have access to should be 5-star medicine. But unfortunately, with socialized medicine, you're not getting the 5-star treatment. You're going to get like a 1 or 2-star treatment. Why? Because the government does not want to spend a lot of money on people, if any at all, and it wants to try and find the cheapest, bottom of the barrel way of providing healthcare services. And we have seen that with how our veterans are treated in the VA. We've seen that with Medicare and Medicaid and several other social programs that they don't work. They don't provide what they say they're going to provide. So if people think that with socialized medicine they're going to have access to anything and everything, I got news for you. You are completely and utterly wrong, because that's not how the federal government works at all. Like, if you want the best health care, you need to go out and get it on your own, or you need to work for an employer that provides the best kind of health care, because health care costs money, whether it's socialized or not. Like, just because a government provides socialized medicine, that doesn't mean that it's free. It's not free. It comes out of your taxes. Even if you're not rich, you are still paying for that socialized medicine. They make it seem like it's free, and they say it's free, but it's not free. Because if it was free, then how would those doctors and nurses and healthcare providers get paid? If it was completely free, they wouldn't have wages at all. But guess what? They do have wages. So obviously, they have to get paid with monies. Well, those monies come from your tax dollars. Your tax dollars are pulled out of your paycheck by your employer and sent to the federal government. So, for those that think, it should just be the rich that pay for all that, well, that's not fair. That's not right. The rich already pay a lot in taxes. They already do. Why? Because they make more money. But here's the thing. With socialized medicine, everybody should pay into that system if everybody's going to use it. Because it would not be right to put that financial burden only on the rich. And I'm not even a rich person, at least not yet. I pray that I become a millionaire, billionaire someday. That would be awesome. But, even in my current status, at my current income, I don't think the rich should be responsible for everybody else's health care. Like, that's just not realistic, and that's not right, because that's taking money away from somebody that they earned and applying it to somebody else that they don't even know, and it's not even the best health care, which to me sucks. Because I look at it this way, like, I pay a lot of money every month for my health insurance because I'm a private contractor, / business consultant, however you want to word it. And I've had my own health insurance policy for over 10 years now because it's just better for me to do that than to go through an employer. So, like, I probably pay, I think it's like $623 a month in terms of insurance premiums, which I can't stand it being that high. And this all started back when Obamacare was passed. In terms of the price increases and hikes, it was really quite horrible. So, before Obamacare, my health insurance, which was a pretty good policy, it cost like maybe $111 or $113 a month. When Obamacare passed, immediately my health insurance premium went up 300%. It went up to, it was like $350 or $360 a month. I mean, it went up a lot. And I was just shocked by this. I mean, I kind of figured it was going to go up because I figured that the federal government got that law passed. Health insurance companies were not going to like it, and they're going to try and recoup future losses as soon as possible because they know how the federal government is. The federal government doesn't like to pay its bills. So they know that if they're going to get in bed with the federal government, they better get their money while they can. And that's what they did. So over the years, since Obamacare, I lost my health insurance, even though, they said that with Obamacare, you will get to keep your health insurance policy. That's not true. That was a lie. My health insurance policy was made illegal twice by the federal government. And so I was forced onto different policies that I didn't want, that I didn't like, but yet I was trying to pay more money. So now I pay like $623 a month for health insurance, and yet less is covered. I have less access to doctors. The medicines are more expensive, and they try and push you onto generics. And, generics are not the be-all, end-all. There are not generics for everything under the sun. So sometimes you have to get the brand name. And other times you might have an allergic reaction to a generic, which that happened to me. I had an allergic reaction, whether to the actual medicine or the formulary or one particular ingredient or a dye. We don't know what it was. Me and the pharmacist, we don't know, but we had to switch to the brand name. Well, guess what? I got punished by my health insurance for needing to switch the brand name. There was one brand name that was not covered at all, so I had to pay the full cost of that, which sucked. I thought that was completely wrong. And then another time, I had to pay not full price, but pretty close to it, even with filing insurance. And it's just one of those things that it's like they don't care. Health insurance companies, they used to care, because I know that I've been going through the same insurance company for several years now. And before Obamacare passed, they were way nicer, especially on the phone. Like, you could actually get a real person on the phone when you called. Since the passing of Obamacare, it's kind of hit or miss in terms of the pleasantness of the person on the other end of the phone, if they even pick up. And so usually what I try and do, if I need to discuss something with an insurance company, I just message them directly through their app or an email or something, because it's not always pleasant talking to them on the phone, because I just got sick of their attitude and their lousy excuses of why they suck at their job. But anyway, when it comes to Obamacare, it was a nightmare, because it was just a stepping stone for the federal government to try and take over all of healthcare within the United States. And I look at it this way, I pay a lot of money for my health insurance, so I expect 5-star service. But let's say, for example, we do go socialized medicine, which I pray that we don't, because it sucks. And, let's say we do end up going socialized. Well, even if we do go to socialized medicine, I still expect 5-star treatment and 5-star service. But here's the thing, under socialized medicine, you're not going to get that kind of treatment. It will suck. It'll be, instead of getting a 5-star service, you'll get a 1 or a 2-star service. And I kind of look at and compare it to like Expedia.com, like when you're comparing hotels. That's the best way to describe it. Let's say, for example, you're paying a lot of money per month. You're paying for like a really swanky hotel, but then when you get there, you're staying at like a cheapo motel. You're still paying the luxury price, but you're staying at a motel with cockroaches and the room is filthy. That's what it's like. Because I guarantee you, under socialized medicine, you are not getting the top of the line technology. You're not getting immediate access to doctors that you need. I mean, you will have access to the ER, but there's only so much the ER can do. You know, they do try and get you to go see a regular doctor that specializes in whatever problem you're having, because that's the whole point of the ER. The emergency room is to handle emergencies. It's not for everyday care. It's not for a family practice. It's not for a GP or a nurse practitioner or a physician's assistant. That's not where they operate their business out of. It's just truly an emergency room in a hospital or urgent care, whatever the case may be. So it's one of those things that with socialized medicine, you're not going to get the 5-star treatment, but yet a lot of tax dollars will be taken out of people's paychecks to pay for this health care, but yet we, the citizens, you and me, we're not going to get the top of the line care. And I've also seen this in other countries, whether it's the UK, Australia, I think New Zealand, because I've seen some groups on Facebook where they were complaining about their health care, especially if they had a chronic illness. It was very frustrating. Oh, in Canada, they have lousy health care, especially if you have a chronic illness, which is very unfortunate for someone that suffers. I mean, every day with something, regardless of what it is. And so, you know, with chronic illnesses, those drugs tend to be specialty drugs, and they're very expensive because they treat something that is long-term, typically, until they come out with a cure. And what sucks with specialty drugs is that they do tend to be more expensive, and unfortunately, governments, not just ours, but especially socialized medicine governments, do not want to pay for those drugs. So they try and push people's diagnosis out as far as they can and not get them on medicine right away. And then they put them on medicines that do not agree with their system or their immune system or their body or whatever the case may be. So it's like pulling teeth to find the right medicine for that patient. And sometimes these patients, the government of whatever country, if they're socialized medicine, they delay their treatment so long that they end up in the hospital. And it's really sad and it's really bad. So again, you're not getting the cream of the crop with socialized medicine, even though, I mean, it's kind of a Shangri-La, you know, vision or fantasy if you think that socialized medicine is the best way to go when it's not. And I would think, with considering how many people travel here from other countries to get medicine, I would think that would prove that it's not that great. But yet, there are some extremists within our government, what I call crazy liberal nutbags. They want socialized medicine just hardcore. And it's like, you know, you can't do that to the American people, because that's, first of all, that's not what the majority of us agree with. And number two, health insurance is not a right. And that's probably going to shock some people and irritate some people, but it's the truth. Health insurance is not a right. Health insurance is a product that was invented in the 20th century. And so it's something that you purchase to help buffer the cost of medical care. So a right is something that's intangible. It's something that you can't purchase. That's what a right is, whether it's the right to vote, right to bear arms, your right to own property, things like that. Those are things that, you know, you can't purchase that right. Health insurance, it's a product. You purchase it, you have a choice whether or not to purchase it. You know, it's up to you. So, and another thing with the Affordable Care Act is that it forced people to purchase health insurance, and if they did not purchase health insurance, whether through the marketplace, which is a stupid name that they used to purchase government health care online, or you could purchase privatized health insurance policies like what I do, or you can go through your employer, but if you can't prove that you have health insurance, at least at that time, you would be fined by the federal government via the IRS for every year that you don't have health insurance, and over time, the fees would go up drastically into the thousands as a punishment for you not having health insurance. So it's one of those things that another reason why that law was unlawful and not by far a good thing to ever implement was that the federal government cannot force you to purchase a product. They cannot. But, you know, just so you know, that just because something comes law, that doesn't mean it's legal. I know that sounds kind of confusing, but just because something is passed in legislation and it's the law, it doesn't mean it's legal or correct. And Obamacare, the Affordable Care Act, is one of those examples because the federal government, it's like they can't force you to buy a car and they can't force you to purchase a ham or a turkey around Thanksgiving or Christmas. But yet they were trying to force people to purchase health insurance. And so that was one way the federal government was trying to squeeze people into purchasing socialized medicine type policies, and also try and force out health insurance companies and put them out of business. Like, for example, we used to have a ton of health insurance companies that offered health insurance in the state of Oklahoma. I only have access to 2 different health insurance companies right now to purchase a health insurance policy, and that's Blue Cross Blue Shield and United Healthcare. And United Healthcare, I'm not a big fan of at this point because I don't like how their contracts are written. Because the thing you have to remember with health insurance, when it's privatized, like in the United States, it's a contract. A contract has to include a minimum of 2 people in there, which means you and the insurance company, right? So you're saying in this contract you will pay this amount of money per month for an insurance premium, and in exchange the health insurance company will provide these services at this rate, this cost, this percentage, this copay, whatever the case may be. And it's usually supposed to be a yearly contract. Well, what United Healthcare is doing, and I find this very shady, but United Healthcare has gotten in bed with the federal government, so they're kind of going along with socialism. Slowly but surely, it's creeping that way. So United Healthcare has started offering 3-year term contracts, which suck because so much can change within a year. Like, if I don't like my current policy, I know I can just change it the following year. Well, if you sign off on one of these 3-year policies and some kind of catastrophe happens in your life, or maybe you want to switch policies, you're pretty much stuck with that policy unless you go through a lot of hoops to cancel your policy and to get on something else. And also what sucks about United Healthcare's 3-year term contract health insurance policies is that I've looked at them because they sound really nice. It sounds like, oh, you'll only pay $40 or $60 a month. Well, that may sound all good and everything. However, part of those policies is that you can't use hardly any of that policy for the first year. So let's say, for example, you need to get an MRI done or you need a CT scan. Guess what? It's not covered. And if it is covered, it's not very much because they don't want you to use your policy, but yet they want you to pay money into it, which is stupid because if you're purchasing something, you should have immediate access to your health care. Immediate. It should never be delayed. It should be there when you need it. So another part of the policies is that you can't use a lot of the expensive stuff, which would be specialty drugs, diagnostic testing. You can't hardly use any of those services for the first year. So then the second or third year comes, and then it goes into your co-insurance, which I don't completely agree with how co-insurance is used and manipulated. It used to be way easier to understand and way easier to utilize. But the way co-insurance works is, let's say, for example, you have a $200 deductible, which that's an awesome deductible because it's super low. But let's say, for example, you go to the emergency room, you easily meet your $200 deductible. Normally, before the whole co-insurance hairy details or gray area, you would immediately go into the part of your policy where insurance covers everything. Well, unfortunately, with the growth of co-insurance, what happens is when you have co-insurance is you go to the ER, you meet your $200 deductible, and then whatever is over that, let's say you have 40% in co-insurance, which means you're still responsible for everything after that $200 deductible that you just paid. But you're only responsible for 40% of all those bills until you reach your next deductible, which let's say is $8,500, for example. Well, you're still responsible for 40% of $8,500. So let's just say it's $8,000, and let's say the coinsurance is 50%. That's going to be $4,000 that you are still financially responsible for, even after you met your $200 deductible. So now you've got to meet the next threshold. I mean, it's almost like Mario Brothers or Super Mario Brothers with this health insurance now. It's like you've got to go through these different tunnels, these different levels. You've got to collect all these mushrooms and flowers just to have all these points just to get you to the next level. And it's stupid because health insurance and your life is not a game. It's serious. It's your life. Your life has value. You have worth far above and beyond any dollar amount. But unfortunately, because of what Obamacare did, it really tried to punish health insurance companies for even being in business. And they acted like they wanted to do business with these health insurance companies, but they really don't. They really just wanted to put them out of business so they could try and force everybody to be on socialized medicine. So, I mean, here's another thing. If the federal government is intent on getting rid of health insurance companies, which it is, systematically over the years it is doing this, because we've seen less and less insurance companies offering policies in the state of Oklahoma. Let's say, for example, the federal government, let's say they succeed and we have socialized medicine and we no longer have privatized health insurance. Can you imagine how many companies would go belly up and how many people would lose their jobs and lose out on their money that they're supposed to make? They're going to miss out on their wages. We're not just talking health insurance or what's it called, insurance agents. You're talking about HR people. You're talking about accountants. You're talking about anyone that works within that insurance company will lose their job. So it's not just insurance agents. It's not just the people that sell it. It's not just the sales department. You've got marketing. You've got administration. You've got accounting. You've got auditing. You've got engineers. You've got IT. All those people will lose their jobs immediately if the federal government gets its way and implements socialized medicine and tries to completely take over every health insurance policy within the United States. And my thing is that if the federal government cannot even manage or balance its budget, it can't even take care of our veterans, it can't take care of the disabled, it can't take care of the elderly, it can't take care of the chronically ill, it's failing at Medicare and Medicaid, Social Security is a joke, it's bankrupt. It's been bankrupt and broke for years, but no one wanted to say it. And if someone did say it, they got demonized. And it's like, you know it's a lie and something is going on when someone demonizes something that's not demonic. That's the thing. That's always a red flag to me. So whenever someone does that, your ears need to perk up because you need to look below the surface of what their true intentions are. Because whenever people were really telling off other people whenever they would say, oh, Social Security is not working, we need to change it, and then they got told off for speaking that way. Like, why would you tell someone off that's speaking the truth and is looking at the facts? They're looking at the data, the raw data. Like, if you're trying to run a company and you're having a financial crisis, would you rather your people that work for you just shove everything under a rug, sweep it under the rug, and act like it's not there, and then when you go and ask them about it, they get angry and defensive and put it back on you? Or would you actually want someone that tells the truth and says, hey, we've got a problem, and we need to address this immediately, otherwise this company is going to go belly up? But the thing with the federal government is that it just keeps adding on all this debt for future generations, and then they just start printing money, which affects our currency. It affects our interest rates, which in effect affects the entire banking industry, which that includes long-term effects on real estate, on buying of cars, on pretty much anything that is financially driven. And, your economy is the backbone of your country, because that's how people earn their money. That's how they earn their wages. So, it's like, we the people, we are the government. However, we have to be good stewards and good caretakers of our federal government, which belongs to us. And, to me, it just looks like we haven't been good stewards of our government, of our country for several decades. And you can tell with the instability of the federal budget. Whether we're fighting a war or not, we should have stability within our country. Are we going to have ups and downs in terms of the stock market? Yes, that's how a healthy market functions. Companies grow, companies, got a business, or maybe they invent a new product, a new drug, that's the fluctuation of an economy. But, what you're talking about, or what you want to look at, is the entire overall stability of your economy, of your society, and your country. And it's never wise to put all your eggs in one basket with this. And if you're talking about socialized medicine, I would never want the federal government to be in charge of that, because they're failing at so many other things. And it just hasn't really impressed me at all. I mean, I am a Republican, I'm a capitalist, but I also believe in taking care of our own in this country. And right now, we're not taking very good care of our own. And perfect examples of that is Medicare, Medicaid, Social Security, disability benefits, our veterans. I mean, those are some of the big ones that we should have been taking care of these people for a long time. Like we should have gotten this process down to a T. Like there's really no excuse for what's going on. You know, I look at it this way. If Amazon was in trillions of dollars of debt, you know, do you really think they would still be in business? You know, the federal government, it gets into so much debt and then it just prints a bunch of money. But if a business were to do that, I mean, it's just not equality. It's not equal. So I think the best thing to do is to have a free market, because that puts control of your life in your hands, not somebody else's. Because the majority of adults can very much handle their own life. It's actually very rare that someone can't, which is why we shouldn't have a bunch of people on social welfare programs, because that encourages people to not work, to not get back out there and make their own money, and to strive for something better. I think we've got some problems. And unfortunately, I'm just really disappointed in our unions, and some of our unions that have openly supported Obamacare and other legislation that was just very liberal. Because I think that if you're trying to look out for your members of your union, you're not going to do something that's radical or extreme, and you're not going to put basically control of your union in the hands of the federal government. And a big reason for that is the federal government, if they don't like you, they can shut your union down at any time. So if I was in a union and I was in charge of a union, I would never get in bed with the federal government ever. I would be very cautious about that. And I would never openly support one candidate over the other. It doesn't matter, Democrat or Republican. Unions should not be involved in politics, because politics is not the founding of their organizations. The founding of their organizations is workers' rights, workers' wages, safe work environments. And we have a lot of those things. We can always get better in certain areas in helping people get better pay, but, you know, better pay doesn't come from donating over $200 million to the Democratic Party during an election. Those monies could have been given to the members to help them with their wages and with their health insurance benefits. I was very surprised to read some of that, of how many millions of dollars these different unions give to all these political, all these elections, especially the Democratic Party. It's like 96 to 97% they give to Democrat candidates. And I just think that's wrong. Like, even if they were giving millions of dollars to a Republican candidate, I would still say that's wrong, because those monies should not be going to that. It's not right. It's technically a misappropriation of funds, is what it's called, and that's technically a form of fraud. I don't know how they're getting away with it. My guess would be if they're trying to file it as tax exempt or 501c3 or some other stipulation. I'm just guessing. But either way, it's still wrong. Like, that's what I'm talking about in regards to, just because something has been passed in legislation, that doesn't mean it's technically legal. Because we do have some laws in this country that are not legal and they're not right. Which is really sad that stuff slips through the cracks, but sometimes it does. But the important thing is to remember what our beginnings are and where we want to go. Those are probably two of the most important things, I would say. So that's what I wanted to discuss in this short podcast about unions, and particularly their very odd support of Obamacare and the Affordable Care Act, and just what they're doing with that. It's really sad. But I will say this, regardless of what these unions are supporting, I still think they have good intentions in regards to their workers, but I do think they need to get back to those good intentions, get back to their origins to really help their workers. Because giving away millions of dollars to a political candidate is not going to solve their problems within their union. That's not the job of a political candidate. That political candidate is not in charge of that union. It's the members that are in charge of that union. So I just think that things could be better. I was disappointed to read some of those things. It's kind of disheartening. But I do think things can get better, and they will get better the more people realize their rights, their workers' rights, their labor rights, their citizen rights. You know, when people wake up and realize the rights that they have, then they know how to navigate stuff like this, and then they're not beholden to somebody else, and they realize that they can be confident in who they are. And that's really the purpose of these podcasts, is to help people have the confidence in themselves that was already there, but to really utilize that to the best of their ability and realize that your life has value, your work has value, your labor has value, and everything you contribute to this society is a blessing. So regardless of who you are and where you are listening to this from, you know, whatever country or state or city you're listening to this, I pray that you're happy, healthy, whole, and that you're very prosperous in everything that you do. I truly do pray for that, for all of you that are listening to this, and for any future generations that come across this podcast. You know, just always remember that your life has value and your happiness matters, and it has value as well. And always strive for the best. Keep pushing forward. Don't give up, even if you read something disheartening like what I read with some things. But it's just, you know, disheartenment, I guess is the right word. It's just an emotion, but it's also an awakening in the mind of something that shouldn't have happened or shouldn't be done. But I look at it this way. You know, every day is a new day, and we can always turn over a new leaf and strive for something better and do better things with our lives, every single one of us. And that is a blessing in of itself, that we can make our country better every single day for the rest of our lives. So that when we do pass away, which hopefully is, you know, when we are at least in our hundreds and have a long, wonderful life, that whatever we leave our children and whatever we leave future generations, that we left it better off than when we were here. And to be a blessing to future generations. I think that's a wonderful way to look at things and to strive for that. I think that's a great thing. So until next time, have a wonderful day and a wonderful week. Thank you so much. Bye-bye.